Hi, everyone. I'd like to welcome everybody watching the podcast today. My name is Dr. Reda Tolba. I am the department chair for the Pain Management Department at Cleveland Clinic, Abu Dhabi. And I'd like to welcome Dr. Francois, who is one of our consultants in the Pain Management Department. And today we'll be discussing the pain management, what's the definition of chronic pain, and what services do the department offer, and answer maybe some questions that a lot of people would like to know about our department. So welcome aboard, Dr. Eric.
Hello, everyone.
So first of all, I would like a lot of patients that come to me and sometimes they don't know exactly what chronic pain is and what our department do. So can you tell us a little bit about what we do as a service and what is chronic pain and the basics of the treatment for patients who come to us at the pain clinic?
Okay, true. So here in Cleveland, Abu Dhabi, we are proud to offer a multidisciplinary approach and to offer a full spectrum of treatment, because we know that chronic pain include multiple mechanisms, including emotional distress, functional, physical distress, and also somatic problems. So we've brought here in Cleveland Clinic multidisciplinary team to offer this full range of treatment. So we have physician, pain specialist, high-skilled pain psychotherapist, physiotherapist, and also we collaborate very closely with the neurosurgical team, and in order to offer the best treatment and the last innovative treatment to cover this main problem and offer possibility for the patient to improve the quality of life and restore a better function.
Very good. So this brings a very good point about some patients that come and they've been suffering for 20 years from chronic pain or so forth. And sometimes they are coming and expecting a quick fix. And a lot of times our role as an physicians, but also an educators, to help those patients kind of go through how we can help them with their journey. So how do you approach patients coming to you with all those complaints?
That's truly a very good point, because clearly expectations should be reasonable. We cannot cure a pain that lasts for more than 20 years. So we need to be reasonable at what we can offer, and that's what I said before. Offering different treatment to cover different aspects of the pain is important. So we usually manage with the patient with a full assessment to know if there is any kind of a burden, emotional problem, physical problem, or other spine-related issues or any other issue that can be fixed. So we basically offer this comprehensive and holistic approach to cover the all aspect of the pain.
So speaking of other procedure as well, a lot of people come and ask me about what we call regenerative medicine. And there's a lot of, some promising data, some not so promising as well about it. But we don't talk about the positive things. What do you see, what can be offered in terms of regenerative medicine for patients like sports injury or suffering from arthritis and other conditions?
So there are different conditions where we might offer, we call it the PRP injection, and that allows some regenerative treatment for those who are suffering from tendon tear or some, as you said, sport injury. And then looks like promising. So, and on the top of that, there will be not very soon, but quite in the next future, some kind of new treatment called gene therapy that might also offer a better chance to heal and help the healing process, yes. Very
good point. So now I'm gonna move a little bit talk about cancer pain, and I'll talk also later on about the interventions that we offer as a highly skilled pain interventional experts. So first, let's talk a little bit about cancer pain and what type of pain do patients suffering from cancer can have, and what are the options for those patients?
So again, cancer pain is also a multifactorial type of pain. We have, we call it nociceptive pain, mainly the pain from the tumor causing pressure on some structures, causing pressure on nerves, and that might be the part of the pain mechanism, and also what we call neuropathic pain, so means pain from the nerve injuries, and also inflammatory pain. So typically for cancer pain, We use also comprehensive management, including pharmacological treatment like opioids or different group of medicines. But whenever these medicines are not helping enough the patient and the patient still feel pain or not tolerating that much the side effects of the treatment, we can offer more specialized treatment like intratical pump delivery. We can maybe talk about this.
So I was going to ask that. So a lot of patients don't know about intratical pump that we put some medication like morphine. So can you tell us more about that and how this can tremendously help patients suffering from cancer and as well as complicated non-cancer pain?
Okay, so the basic of the intratical pump delivery, it's mainly to place a reservoir in the body of the patient connected to a catheter that's going to deliver very precisely a medication through the spinal cord. And it allows to reduce dramatically side effects, and mainly from constipation, from nausea, and less sedation and less drowsiness. So, and also by delivering very high concentrated, a mixture of medication, we talk about opioids, but also local anesthetic, we might offer a much better control of the pain.
And there is also some studies that shows that it can potentially improve survival for certain cancer pain who are cachectic.
It's true. So clearly having a better pain control might allow, a longer survival rate, yes.
Okay. Thank you. I'm going to move to another thing that we see a lot in our clinic, which is the complex spine pain and prolonged post-operative pain. A lot of patients who had successful surgeries, others not as much fortunate, and we'd like to talk about what are the options for this patient from simple injections to more complex. Can you tell us more about what we can offer in our pain team, by our pain team to our patients suffering from what we call failed back surgery syndrome or persistent spinal pain syndrome?
Exactly. So that's a wide range of pain topics in our department because, of course, postoperative pain, it's a major burden condition. It's usually very challenging. So we also use different type of treatment, including pharmacological treatments like different group of medicines from anti-neuropathic pain relief for those who are suffering from nerve injuries, post-operative nerve injuries, but also much more advanced pain procedure, including radiofrequency ablation for those who are suffering from spine-related issues. And sometimes we might also consider more advanced technology like spinal cord stimulator.
So can you tell us more about spinal cord stimulator and different types of stimulators? How can it help those patients?
Okay, so the concept of spinal cord stimulator is mainly to generate some electrical impulses in the nerve structures or in the spinal cord to basically disrupt or stop the pain signal before it reaches the brain. It's a kind of new technology that offer very good results for many patients who are suffering from persisting pain after a lumbar surgery. So there are globally two types, which one is mainly to target the spinal cord, we call it spinal cord stimulator, and those who are targeting mainly the peripheral nerve system, and they are called peripheral nerve stimulator or dorsal root ganglion stimulator. And here in Cleveland Clinic, we offer these different type of stimulator techniques.
And I always, when I talk about those therapies, you need a robust service to have a successful service for our patients. So what's different here in Cleveland that we offer for those patients in terms of the team? Because those patients sometimes that require multiple post-op visits, multiple visits afterward to ensure that the stimulator is working properly. So do you need a robust structure to be able to provide that service for the patient?
That's crucial, having, that's what I said for the introduction, a high experienced pain psychotherapist, because having a chronic pain for such a long time, of course, affect your emotion. So you cannot be rid of your pain only by a stimulator. We need a robust, as you said, team to cover all these aspects. So having in Cleveland Clinic all the multidisciplinary team, including psychological support and physical support, which is also a very important consideration when it considered to recover from physical deconditioning and help a patient to restore a better function. That's true.
And I'm very, fascinated by this technology, and by selecting the right patient, sometimes it can be life-changing. So I'm gonna move to the future of pain medicine, and now we're seeing a lot of overlap between spine surgery and pain management. And here we're lucky to have a collaboration between both services and work as a team. So can you tell us a little bit more about some of the newer procedure in the horizon that could be potentially offered for our patients going forward when it's available? What is new?
So, as we know, it might be extremely challenging to pinpoint specifically the mechanism of pain. And we know, unfortunately, that for the last few years, surgery might not help every patient. So, as you said, there is an overlap now with the pain procedure and the surgical procedure. And to avoid this burden situation whenever a patient suffers from postoperative pain, there are many now new technologies that are much less invasive than surgical insults. So now there are different group of pain procedure. One looks like extremely promising. It's called basal vertebral nerve ablation. That are designed to treat pain patients for suffering from vertebral pain, actual pain, and studies are extremely encouraging and promising, having 5 years feedbacks that approximately 60% of patients are still getting almost pain-free after this procedure. And another very promising procedure is, we call it interspinal spacer. So technically it means that we're gonna put a small device in, we call it the interspinous space, to treat patients suffering from spinal stenosis and spondylolisthesis. And as the same, we might offer a chance to get significant pain relief without the risk of taking risky surgical procedure.
And of course, this is in consultation with our spine surgery team. It's done by both services to see what's the best approach for the patients, because not every patient would qualify for that, of course.
Of course not. Selecting the patient is the must, for sure.
Exactly. So it comes down now to, again, we want to talk about the present, we talk about the future, and we want to conclude by saying, a few words for patients suffering from chronic pain, and how can we try to help them as much as we can. So any tips and tricks to kind of for those patients?
As we know more and more, so the knowledge of the neurobiological mechanism of pain, new imaging, so they will be able to offer, a more targeted and offer more specialized and tailored treatment for every patient. So I guess that the future is quite bright in the pain, although it's going to be challenging, but we might be able in the next future to select the right therapy and offering much less side effects or complications as it used to be before.
Thank you very much, Dr. Francois. And
my pleasure.
Thank you.
Thank you.
Thank you, everyone.